Attention pre-dental students. Over 12,000 applicants each year apply to dental school. Out of 67 accredited schools in the United States, an average of only 90 students per class earn the privilege of acceptance. As former applicants who struggled through the rigorous ADSAS process ourselves, we understand the hard work it takes to be one of the lucky few to get accepted. That being said, we are happy to announce that we are now offering Pre-Dental Mentor, a program designed to give back to the dental community and give you the best chance in getting accepted to the dental school of your dreams. Our brand new Pre-Dental Mentor program includes a team of 5 coaches who have all been a part of the ADSAS application within the past 3 years. Pre-Dental Mentor offers essay reviews, mock interviews, resume editing, secondary application editing, DAT prep, a personalized schools list, and an application checklist. To pre-order, slide into our DMs and get 30% off before June 1st. Contact us at dental.student.vibes on Instagram or email us at dentalstudentvibes@gmail.com. We only have 25 spots, so sign up before it's too late. We sincerely thank you for your support over the past year and are extremely happy to have the opportunity to give back. We were just in your shoes not too long ago.
What is up, Vibe Tribe? This is your boy Matt Havis, and I'm sitting here with you today to present to you a killer interview. We interviewed Dr. Alwan. He's an international dentist based out of Cairo, Egypt right now, and the man has his stuff together. He went to school in Georgia, and here he is. He's doing his residency in Egypt, crushing the game. Dentists across the pond, this is how you want to be. And we discuss everything with him, from being an international dentist to potentially coming to America, and how things are the same but still different over there in Africa. So with that being said, I want to present this opportunity to you guys. We have our newest venture out. It is called the Pre-Dental Mentor. And here at Pre-Dental Mentor, we, the Dental Student Vibes podcast, will mentor and coach and get you guys into the dental school of your dreams. So sign up today. Website drops on June 1st. We love to see it. And remember, follow us on Instagram at dental.student.vibes. We love to hear all of your feedback, your questions, your comments, your concerns. Make sure you catch our Q&As that we host on Thursdays. We love doing it. We love the feedback. We love all the info that you guys present to us. We love to be able to help. So with that being said, we hope you enjoy it. Let us know what you think.
Welcome back to another episode of the Dental Student Vibes podcast.
Today, we have a very special guest joining us via Zoom all the way from Baghdad, Iraq. Dr. Tahreer Alwan is a recent graduate of dental school from all the way in Georgia. That's the country. He's currently doing his residency in Cairo, Egypt. Dr. Alwan also has a twin brother that is a dentist as well. Dr. Alwan, how are you doing today?
I am well, thank you. How are you guys?
Doing well.
We're doing good, Dr. Alwan.
How have things been going in Baghdad and in Iraq with all the wake of this COVID-19 pandemic?
People are just quarantining all the time and social distancing. They're trying, and people are doing well. That's good. So the curve is being flattening, which is good. Hopefully.
Right. Hopefully.
Hopefully.
And you mentioned earlier in your county, you said 0 cases in your county right now.
Yes, 0 cases, and up until now, 0 cases has been reported in here in the county, and people are really appreciating that. So that's a good motivate for them to stay at home.
That's great. So are you working right now? Are you still? Because I know a lot of dentists in the United States are not working right now.
No. Like dental clinics are absolutely closed. Closed, all of them. I mean, state ones and private ones are all closed.
Okay, wow. Cool. Well, so are you guys still seeing like emergency patients or about that?
Yeah, so emergency patients are being treated as an emergency patient within state hospitals, huge state hospitals, not private ones.
Okay.
Inside the emergency section. So state hospitals state hospitals around the country have got their own dental sections for emergency cases. And there are absolutely like a small number of doctors who are being worked there, like scheduled to work there. Few of them, not too many, because patients are absolutely few, not many of them.
Right.
So you
But
haven't
still,
been called in?
there's absolutely some emergency cases.
Right. Okay. So, Dr. Alwan, can you take us back to how you got into dentistry? Just tell us a little bit about yourself.
Well, it all started when a friend of mine went to study also abroad, dentistry. I don't know why did he choose it, but he did like it. And I remember that I did FaceTime him and asked him, how is it all going? He said that it's pretty interesting. Things are well. And when it is coming to the practical way, he's doing such a good job that he's enjoying. So me and my twin brother has started to Google dentistry things and see all these videos, YouTube's vlogs, and we came to like it. So we searched around internet, Google, where to study. So we had the chance to study here, maybe inside the country, or maybe we had less chances. The thing is that we study here, we get admissions to our states universities here due to our scores. The higher the score you got, the higher chances you got to be enrolled in a medical school.
Mm.
So accordingly, we had to study dentistry abroad. We Googled, searched, and we chose Georgia, the country, not the state.
Mm-hmm.
Okay. So
And then
that's
we got in.
Was it really difficult in the application process?
No, actually, at that time, Georgia wasn't that difficult. Not to get in and not to apply. It was absolutely okay. A simple, small application that I filled, and then I got the answer back, and then I had a flight there and continue all the paperwork and got accepted. Was really easy, really easy. Took about 3 or 4 days, nothing more.
Really?
wow, that's quick.
Because
Yeah,
for
that's
us,
quick.
the application process is months long,
Mhm.
and then you go on the interview and.
Yeah, I can understand this because application process here in Iraq, in my country, that would take the same, like months, right?
Right.
But there it was really quick and easy. I was shocked at that. I was like, wow, you guys are doing quick. It was
Mhm.
quick, really easy and quick.
So, so you're practicing in Iraq right now. So was it difficult to like transfer from Georgia back over? Or?
No, I finished the whole study process thing, bachelor degree back in Georgia. So
Okay.
I graduated there.
Right.
And I did choose Cairo, Egypt, not Iraq,
Oh.
to have my residency. And there are some number of facts that I did choose Cairo over Baghdad. They have got good universities. I mean, university hospitals back there in Egypt, and a really huge amount of patients
Mhm.
who are willing to let us to work, which is
Right.
nice. This thing I couldn't find here in Iraq. I think it is a bit harder than Egypt to do it here. I mean, for me to have a residency because I have graduated abroad. So it is
Mhm.
a bit difficult for me to have the residency here. That's the thing. That's the thing.
Right. So is it
But
difficult to like transfer licenses and that sort of thing between countries?
actually, so in Georgia, I have just finished my bachelor degree. I didn't have the license
Mm-hmm.
to be a dentist back there.
Mm-hmm.
I still have to go through an exam here in Baghdad to be licensed to work. I still would have to have the exam that is actually postponed due to the COVID-19. And there's no time yet. There is no schedule yet. They didn't schedule yet. I'm just waiting for the exam of Iraq. Egypt, I didn't have exam. All the materials that I have studied, they did like. They said, it's okay. You can just do the paperwork and then go to work in a university hospital. So Egypt was the easiest one, really easy, really, really easy. But here in Iraq, in my country, I still have to go through a exam, which is
Mm-hmm.
really, really hard and awful.
Right.
Of course, but it's all worth it then, you know?
Absolutely. It is all worth it. Absolutely.
So
All
I
right, so
want to
Doc-
talk.
Go ahead.
Go ahead, Cole. All right, thank you. I wanted to talk to you about your dental school experience. So did you go to the University of Georgia? Like, what was the name of the school?
Yes, the university was University of Georgia.
Okay.
That is the name, official name.
Mm-hmm.
They do teach in, I think, 3 languages: English, Georgian, which is their language, their native language. It's called Georgian, and also Russian, due to the proximity to Russia. So they had to have some Russian programs for Russian students or, I don't know, studies. These 3 languages. Obviously, we did choose English over the rest 2 languages. It was nice. It was nice. I did like the syllabus. They were nice. They were much at the beginning, really much. And, we had all this cultural barrier with the staff. They were mostly Georgians. Like we had to adjust to them. We had to know the language. But we did well. They did well too. Everyone just did well.
And what was your curriculum like? Was it mostly just lecture and classes the first year? When did you get into clinic? What's that all like?
Yes. That's the thing that I mostly didn't like about it. So the first 2 years were all lectures, seminars, nothing else.
First 3 years?
Yes, imagine.
Wow.
Just like first 3 years. So I didn't have an experience about dental school before dental schools, and I thought that it's normal just to be lectured all these years and then be in a clinic. But all these 3 years we were just being lectured, and we had great seminars, actually great lectures. They were all interesting, nice. We had some simple procedures on mannequins, on acrylic teeth, on something artificial. Wasn't that big. The 4th year they started to introduce us to clinics, private ones and the university ones, but we basically watched and assist rather than like individually work and have an own case. We, in the 5th year, we started to manage to have our own patients. I remember that they were like maximum, I had 3 or 4, nothing else. So the rest of the years, I was just assisting. This thing I really hated. I really, really hated. Like, I don't know. I didn't like it. That's why I immediately decided to go to Cairo, where I did have like, wow, too many patients. Like, it was absolutely normal for the university hospital to have 1,000 patients at the same day. It's absolutely normal.
Wow.
Yeah. Egypt is wow. Egypt was wow, really. I was shocked by Egypt. So back in Georgia, so like I'm switching between countries. Back in Georgia, everything was good with the university and lectures. Everything was good and perfect. When it comes to the practical part, I can't say we are on the 0 level there. we were on the 0 level, really. We like 3 or 4 patients for a graduate dentist. This is nothing. This is absolutely nothing. I'm not calling myself a dentist at that time. I didn't. But in Cairo, no. In Cairo, they did well. They're strict. They're straightforward. Like, that is your chair. That is your patient. Go ahead. It's as simple as that. But
That's awesome.
I did like Egypt. University was huge. Campus is huge. University hospitals are wow. Staff is really cooperative. They're willing to help. Everything was good. I did like the hospitals and clinics in Egypt much more than I did in Georgia. Much more, like ways more.
Awesome. So it sounds like your program in Georgia was 5 years, correct?
Yes, 5 years. Yes.
A 5-year program. That's awesome. And then so after that, then you went over to Cairo. So now in Cairo, what's your daily life like? You come in, you treat your patients. How many patients would you say you see a day?
So clinics are huge. It's the University Hospital of University of Cairo. It is a state university. It wasn't a private one. So I think it was easier for the patient to come in and cheaper or sometimes free. I think free for them to be treated. I had to pay a small amount monthly and then complete all the paperwork. I will be enrolled in a clinic schedule. They will inform me ahead of it, like So they have got different clinics. There's the surgery clinic, there's operative clinic, endodontics clinics, prosthetics, and all of these things. All of these things, like there were maximum 10 clinics. I have been, and up until now, I have been in 4 of them. They were amazing and nice. Too many patients, too many students, too many doctors, dentists, residents, everyone is there. Too many dental chairs. And then supervisors are telling us whom to work with, whom to choose, and which chair to choose. So everything is scheduled and directed. Things in Cairo were doing really well, really, really well.
That's awesome. So in Cairo, so have you decided on maybe like a specialty or area of focus that you really like? You know, what's your plan going forward with that?
I liked surgery more of them. Like the most, I did like surgery. Surgery is something huge back in Cairo. I liked it. Like I even thought maybe I would be going to a master's degree there in Cairo, due to the fact that there are like dozens of patients, really.
Right. That's awesome.
It is.
So I just have a quick question. So normally if we wanted to do become like an oral surgeon here in America, we'd have to do an oral surgery residency. Would you have to do another residency to specialize, or is the one in Cairo covering that?
No, the one in Cairo is covering, and then
Okay.
Master of Surgery would take about 3 or something years, 3 to 5 years, that depends. But starting from 3 years, so you will be covered anyway. Like it's a long time, and it's a full time. It's a full
absolutely.
time.
It's your life, you know. But if you're willing to do it and you're willing to be selfless and help that many other people, I mean, the blessings just come afterwards. But now's the grind time.
Absolutely.
That's
okay,
awesome.
So
go ahead, Seth.
Tell us a little bit more about dental school in the East. So like what's required, what's also required for residency? Like, do you have competencies you got to do, that sort of stuff?
Mm-hmm. The East is absolutely different from what you're doing, guys. Like we have got 2 kinds of universities. There's a state one and there's a private one, state and private. Admission to state ones are absolutely free. So you're free to be admission there, free to study there. Absolutely. State ones. Private ones, of course, will be with a certain amount of like certain tuition fee, something. But that depends on your school, the school of the high school. Like the higher you got in the high school, the higher opportunity or chance you got to go into medical schools. Medical school include the medicine, nursing, dentistry, and pharmacology, all of them. These 4 of them would require a really high score, really high one, like say 92 up to 100.
Right.
And what test is this that you'd have to take?
There are no tests. You just take your high school grade, and if you are from the lucky ones who got 92 and up, you will be free. You'll have a free opportunity to study in a state hospital, a state university, sorry. If you got less than that and you still want to study that in a medical school, then you'll have to go through a private ones. Private universities are usually don't require a specific score. They don't. So just fill an application, that's it. You're all done, you're accepted. And then you do have to pay your tuition fee, which is the important thing for them, obviously.
Now, if you're a student who does very well in high school, has the high grade point average that you were talking about over the 92, what would be the reasons for wanting to go to a private school over a state school? Or does that just not happen at all?
No reason, and none didn't happen in a while. No one likes the private ones. So state universities are huge campuses and huge facilities usually. Private ones are less in size, less in everything. So this is how it does work here. So you have state over private, but that depends on your score in the high school.
Now, I just have a quick follow-up question. Does society look at you differently for going to a state over private? Like, do they think a private is inferior, or is it kind of like you're on the same level, you still have the same degree?
That depends. Like, there are certain countries So inside the country, it's okay for them. Like say that I was graduated from private university here in Iraq rather than Georgia. Still okay for the people. They don't care. Like they never care. They've never. But there are certain countries that they just have a, you know, a lower point of view towards them. And I would say this point of view includes mostly post-USSR countries. I don't know why really. But people like think that if I am graduate from a post-USSR country, then I might be not as good as other ones. They just think. I have no idea why. I'm trying to change.
I bet you've seen some treatments from like some patients that have gotten treatment over there, right? And it's a lot of different sort of dentistry, right? A lot of things you wouldn't normally see. Yeah.
I mean, back in Georgia, clinics are doing well, really doing well. They're going strict on hygiene and doing everything well. Modern things, modern techniques, they're doing well. Here in Iraq, private sector isn't like still that much. Still isn't that much. People are relying more on these state ones, which are huge, as I said. So clinics are just like universities here in the East. You have a state ones and you have private ones. People usually prefer the state ones for simple procedure. As dental fillings, they would prefer the state ones. But for more aesthetic reasons, they would absolutely choose the private ones here. Gotcha. Back in Georgia, everything is private. They don't have a state hospital or a state dental clinic.
Right. Gotcha. Okay. So also, you expressed some interest in coming over to the States. So what's your plan with that? Yeah. Tell me about it.
Back in Georgia, we had a really good surgeon that was teaching us. She was teaching us. She's originally from Georgia, but had the chance to study abroad. I think Germany, UK, States. She had a nice trip over them. And she did advise us, all of us, like she said that the most developed dentistry or medicine you will ever think is there in the States. So if you couldn't find it in the States, there you will not find it anywhere else. That said, we do trust that surgeon so much. And she made that impression for us that States had got the best medicine, which is true. Which is true. So we did lots of research. We Googled lots of things, and everything I Google is leading me there. It's leading me. You do need, if you want to study a good dentistry, good amount of knowledge, everything is good. It's there. It's never in the East. It's always in the West. And people here do trust the ones who were graduated from the West, not from the East. Like they like it so much. So if we have got any dentist here who was graduated from the States or United Kingdom or Germany, anywhere, like the East, West, people will prefer to choose him, not the other ones. Right. So people have this good impression about the West, that is this market there.
Yeah. So that means that you would be coming over here to study, and then you'd be going back over to Iraq?
Yes, I would like to have my own business here in Iraq. I think it would have a good opportunity. I like it. I do like it over here in Iraq. People are much more relaxed. Like from what I have seen in Georgia, patients in Georgia are, because they're paying much than in here, or it's all private. People are really, needy. They do ask for many things. People aren't that relaxed. Here in Iraq, they're so much relaxed. So, I know I felt much more tension there than in here. Right. I have no idea why.
And that makes your life a little, calmer, or just transparency,
Absolutely. Here it's a bit calmer.
So tell me, you said you want to open your own business. What would your ideal practice look like? You're going to open your own office. Would you buy one? Would you buy a practice? Would you do a startup? What are you thinking for that?
I think I would like to apply to be working in a clinic with other ones, not my own in the beginning. And I'm planning to work in a one for about 5 or 6 years until I am fully dependent and sure of myself, and then I will start my own clinic along with my twin brother. He's stitching with you there.
Right.
He will be all the time there.
Yeah. I gotta see a picture of you guys standing next to each other.
Yeah.
You guys
Yeah.
are twins, huh? Yeah.
Yeah, we are twins. We are twins. We do look like each other a bit.
Yeah. So what are you gonna do when you practice? You're gonna have both just be Dr. Alwan? You're gonna have different. You're gonna call yourselves by different names?
We will have both, Dr. Alwan.
Yeah. Yeah.
It fits. It fits.
Yeah. Okay.
We even had an idea to be working on the same dental chair, but that seems very slow.
Yeah. That's funny.
Like we tried it back then in Egypt. So for a day we had the chance to be both working on the same dental chair on the same patient. We did it good, but we had lots of fights.
Yeah.
So we quit it. Like, no more. You will have your own chair and I will have my own. So that's it.
Right. That's funny. Okay. So have you taken any good continuing education courses?
Yes, I had some courses. Again, in Egypt, I had. They were, I will say, much more of practical ones than lectures and theoretical ones. The longest of them lasted for 10 days.
Mm-hmm.
10 days. We had 4 of them, theories and lectures and all of the paperwork stuff. And then the rest days we had patients. Continuous education in Egypt is doing well. Is doing well. I think their next business, their back in investment in Egypt, is the continuous education.
Mm-hmm.
They're doing very well on that part. Really,
Mm-hmm.
really well.
Yeah, it seems like it's growing over here too. I think that it's definitely becoming profitable to have the conferences and to be hosting, and especially now, think about it. You can do everything on Zoom. Everything's just transitioning.
Yes.
The Zoom
Yes.
webinars, and so I feel like that's really how it's gonna transition. Yes. But also, we got to get that hands-on experience at some point. Placing implants, all that sort of stuff. You can't just do that.
That's the good thing about Egypt. So hands-on experience is always good at these seminars. There's always hands-on experience. There's always practical section. There's always a practical section. Mm-hmm. You would never go into such a program without manipulating on real patients. Mm-hmm. That's the thing. And it is becoming really, really profitable for them. Really.
Right.
Which is awesome. So what specifically, so you like surgery, have you done any CEs like specifically on surgery? And, could you walk us through, a few of the things that you've done?
Well, I couldn't, I was registered on the surgery course, but due to the novel COVID-19 was postponed. I had, I had a course. Me and my twin brother had a course of the operative and dental fillings course, how to do the anterior composite more good. Like we had some weak points, and then we went to an institute to develop it. It was really good. We had really good ones. They were giving us lectures for about 3 or 4 hours per day, and then the rest of the day we would have hands-on experience and then manipulating on patients for both anterior teeth and posterior teeth. It was really good. The second course we had a course of veneers. It was really good. Mm-hmm. Fast, quick, and nice. Was really good one. We had theories for about 2 or 3 days, and then the next 2 days we had all like patients and practical thing. Was good. We also had the chance to have we started actually something of periodontology, but we didn't finish that. Was again postponed.
Mm-hmm. Yeah. Right. Well, that sounds cool. That sounds like you did a lot.
Yes. The thing about Egypt is that you have the opportunity to do a lot, like really a lot, with very good, experienced doctors. They're very good ones.
I think the impressive thing is how you're getting to see patients at these CEs.
Yes, it's really impressive. Like patients are too many. Like too many patients.
That's
too
awesome.
Many. I remember the first day I walked in the University Cairo hospital, the hospital of the University of Cairo. I was shocked. Like I was like, how are we going to finish all of these patients at the same day? Too many patients, but it was really good, fast, quick. High hygiene standards are wow. Everything is good there. I liked it. I did.
That's great.
That's awesome. So you said that you and your brother eventually would like to practice together. So let's take us through that. So where do you see yourself with your brother working together in the next 5 to 10 years? You know, you have a solo practice, you said, in Baghdad. So what's going on with that?
He decided, like, actually, my twin brother decided to study a master of orthodontics. He's thinking that the orthodontic thing is growing in Iraq here. People are starting to consider orthodontics more than anything else for aesthetic reasons, obviously. He's focusing on that part a lot. He had started to have some courses back there in Egypt, was registered. He had some lectures, I think, or just was, maybe they were postponed. And he's thinking of studying orthodontics somewhere, like maybe the States or Egypt or even Iraq, if he would have the opportunity to do so. But I'm seeing myself as a surgeon, a maxillofacial one, absolutely.
There you go.
Right,
Yeah.
talk about a profitable office.
Yeah.
All right, cool.
Dr. Alwan, do you have any tips or advice for our listeners that might help them with their journey to dentistry, whether they're about to begin it or they're already pursuing it?
Yes, absolutely. The first day we got into the clinics for residency, the first day we started residency, we were absolutely terrified. Like, you know, this patient barrier is a huge thing, We had one doctor of us who was supervising us, who she said, you know, you're never going to learn how to swim until you dive in. So people, don't be afraid and do it. Just do it. Don't be afraid. Never afraid, and never say never. First day I went there, I saw how people are doing very nice dental procedures. I was like shocked. I was like, oh my God, how am I going to do so? And then I walked out doing the best, even a better one. So just don't be afraid and focus on when you really want to be. Just focus on it. This will be the best motivation for you to go forward, to push yourself, to study more, to see more. And in the end, it's a nice adventure. In the end, the result will be nice. You're giving people back their smiles, which is nice.
Mm-hmm. That's great. That's awesome.
Excellent advice.
Thank you.
I love it. And you know, we hear that from a lot of people. Like, everybody seems to be so scared when they, you know, come right out, and then it ends up being fine, you know? So.
Yeah. Like first time I tried to manipulate a patient, I was like, the patient was trying to calm me down. She was a really
you had the patient calming you down.
Yeah,
that's different.
I was very terrified. It was obvious. I tried to calm down, but I couldn't hide it anymore. So she said, just calm down. I know you're a resident and you won, but even if you will do a mistake, there is a good supervisor who will just correct it. It's okay. It's okay.
Right.
Just calm down. And then these words worked. Like, really, I was calming myself down, and I did a great job at that time.
Yeah.
I still have that patient as a friend of mine.
Really?
Wow.
That's great.
Yeah.
All right, Dr. Talman, you have given us some great advice today, and so thank you so much for joining us. We appreciate you taking the time to tell us a little bit about yourself and your journey to a career in dentistry. So we hope you and your family are going to stay safe. Maybe next time we'll talk with your brother as well.
Absolutely. I'm looking forward to have all of us in a Zoom session. Thank you for your time.
Yeah.
And hopefully next time isn't Zoom. Maybe something else with more social.
Right, exactly. Hopefully we'll see you in the future when you come over here to the United States.
Hopefully.
Yeah, Dr. Alwan, feel free to keep messaging me, and I'll keep telling you a little bit more about how we do it in the West over here. So
that will be so good. That'll be so good. Enjoy your time. Stay safe. Social distance, which is so good.
Yeah. All right, Dr. Alwan, thank you so much.
What is up, Vibe Tribe? You're back at it with Matt Havis, and I'm sitting here today to finish off this interview with Dr. Alwan. This was a clutch interview. He came in, he showed up, he conquered. He presented everything that there was to present about being an international student, how things work across the pond, how things go, how he's killing the game, how about his identical twin brother who's also a dentist. He came, he brought it. We hope you guys enjoyed it. If you have any questions, comments, concerns, hit us up on Instagram at dental.student.vibes. Make sure you guys check out Pre-Dental Mentor, dropping soon. And again, look out for those Q&As we got on Thursdays. We'd love to hear from you. Until next time, vibe on.